So now that I have the hinge actually anchored to the waist belt, I need to just check my landmarks to make sure that the hip is in the space where it needs to be. The range of motion hinge needs to be slightly above the greater trochanter, which is right here. So right now it's just a little bit higher than I want it to be, so that the axis of this goes right to where the hip joint is, which is going to be right about here. So greater trochanter, axis of hip motion. So this is about 1/2 inch to 1 inch higher than I need to be. So in order to lower that, I need to lower the waist belt, which is why we cut the waist belt a little larger than it needs to be, in case it needs to slide down a little bit to go over the hip bones. And we're just going to undo the waist belt and lower it down a little bit and readjust it. Now go ahead and park the adjustment straps so it's snug where I want it to be, because it's in line with the axis of motion at the hip. So from here, the last portion to adjust is this lower section, which needs to go and anchor right onto the thigh. There's 2 adjustments that we need to do in order to make that. Obviously you can see here that this is quite a bit of space away, so this is the abduction adduction adjustment, which we adjust from right here. And I will do that now using the larger Allen wrench, because I needed this to follow his hip angle. That's pretty good. I feel like that's right kind of where I need it to be. And then the last thing I need to adjust is to actually bring this lower, because his legs are a little bit longer than what the brace is adjusted for right now. I want this to go kind of centered into the lateral portion of this thigh, and I don't want the top edge of this to be bumping up against this greater trochanter. So the top portion of this pad needs to be below the greater trochanter, which is right there. As long as it's below that and up against the thigh, then we're in a good position. So now I have the hip brace adjusted and where I want it to be. All my alignments look good. From here I'll just do a motion assessment to make sure that as he moves that the hip stays where it needs to be, and make any final adjustments as necessary. So I'll go ahead and ask the patient to please raise your left hip up as high as you can, up to about 90 degrees. Good. And back down. And now extend the leg behind you as far as you can and watch. And it's pretty good. The one thing that we sometimes like to do in portion of this, I know that we adjusted the original tab to 90 degrees and the back tab to 0, but in watching the hip and actually watching the patient perform the motion, if we see that the hip is in fact going higher than 90 degrees or getting to the point of strain on the capsule, we may then adjust this back down to 70 degrees at this point, which we can easily do again from this top adjustment screw for the range of motion hinge. I will go ahead and do that now just so you can see an example of what that would look like. Go ahead and raise your hip up one more time for me. And for him, that's about as high as I want him to go, is right about there, but you can see the brace will actually allow him to go a bit further, but I actually don't want him to do that. I want him to kind of stay right about there, so I need to back this brace off to about 70 degrees on the marker for him. So now that I have the lower thigh strap adjusted to where I want it to be, I just take one last look at kind of the alignments to make sure the brace is adjusted to where I want it to be for this patient. The actual apparatus attached to the waist looks really, really good. The hinge is in line with the axis. The only thing I don't like is my original abduction adduction adjustment, which you can see that there's some space here. So how I kind of would do that is I need to again go back to this adjustment screw, loosen it up to readjust it to where I want it to be for him. So I have the brace adjusted. I have everything where I want it to be. I've watched you move. The brace is completely adjusted to you, and I'm happy with everything that's going on. All the screws are tightened and it's ready to go. The last thing I just need to do, and this is just a pad to prevent any friction from going on your clothes or anything if you were to bump into anything. It's just a pad that goes around the hinge. Just like that. Usually like to spin it to the inside once it's on so that it doesn't become on Velcro. So why we love this brace in comparison to other ones that we've used in the past or that are on the market currently is the adjustability to the patient's body type. Having the ability to adjust the waist strap and be able to cut it to basically any dimension is going to accommodate any patient. But also why we love it, obviously the range of motion hinge is a part of any brace in this particular thing, but the abduction adduction adjustments and the ability to adjust this pad up and down is something that we haven't seen. That for any patient that walks in the door, we know that this brace is going to work, and we can set. It takes a little more time to fit it to them, but on the long run we get less patients coming in wanting their braces readjusted, having less slack in the actual apparatus and adjustment to their body type. So this we were able to accommodate and adjust it to the patient perfectly, so when they walk out the door we're confident that every setting that we put in is going to stay that way and that the patient will have minimal problems after the surgery.